Hi, this is Dr. Peter Grinspoon. Thank you for joining my YouTube channel. Today we're going to talk about what's called concierge medicine. Before we get started, join my YouTube channel and you can get all kinds of free content on drugs and other medical issues. Today we're talking about concierge medicine. This is a relatively new model where people with plenty of money pay for a membership, incredible access to their primary care doctors. I visited a concierge practice. I work in an inner city clinic, and today we're going to talk about the contrast that the poorer people get in their primary care with the richer people, all within one healthcare system. In my clinic, for example, we had the highest rate of COVID in the country during the COVID pandemic for about a week because people lived together in these cramped living situations and they didn't really have the luxury to social distance. Many of our patients in my clinic are immigrants. ICE is roaming around, torturing anybody with dark skin. It's the doctors and the nurses do a really, really good job. They're very pro-social and idealistic, trying to provide excellent medical care under increasingly difficult circumstances. I've talked before about the corporatization of medicine and how the different hospitals are just interested in the bottom line. And I'm not even sure that good patient care is even a blip on the radar these days. So we're trying our hardest with the insurance companies cutting back, the hospitals cutting back, primary care doctors are dropping like flies. I've discussed that in other videos. And I'm working at my primary care clinic. My clinic is sandwiched between a couple banks, a Burger King, a couple parking lots, and some nearby industrial wasteland. You sort of get used to this and you think this is how most people get their health care, even though I know that my patients are really the poorest of the poor, and many of them actually have trouble. They have to decide between, do I pay for food or medicine? It's really a very difficult situation. It's really hard to get medical care on a good day in our medical system, but if you're poor, it's almost impossible. So I tend to go around to different practices and educate doctors about medical marijuana. And I was invited to the concierge practice at my hospital. Now, I thought it would be very interesting. I always love giving these talks, but I thought it would be very interesting to check out a different practice environment. And I was very excited on the day that I went. I had no idea how different the two practices were going to be under the same healthcare system. So for concierge medicine, you pay anywhere from a couple $100 to a couple $1,000, and you get immediate access and attention to all of your whims and needs by your primary care doctor. Now, how much attention they pay to your needs depends somewhat on how much money you pay them. Obviously, if you pay them $500 a year, you don't get as much attention as if you pay them $5,000 a year. Now, the concierge medicine practice that I went to at my hospital, compared to the description I just gave you, was up on the 10th floor of one of the most beautiful parts of Boston with a view of the city. It was absolutely beautiful. It was so nice, I felt healthier just being there. The waiting room had this really nice coffee maker, better than the coffee maker that we have for the staff at my clinic. And in my clinic, poor inner city patients, we could only afford to give them water. Here, you're waiting in the waiting room for gourmet coffee. The waiting room was so large, I got about half of my daily steps just going over to the front desk to ask where the conference room was, where I was going to give my talk. I arrived a little bit early. My curiosity was piqued, so I started exploring. And the exam rooms were literally like 4 times as big as our exam rooms, and everything worked. The blood pressure cuffs worked. They were filled with natural light. And I was really thinking, what do you get in a concierge practice that we can't or don't provide in our regular primary care practices? I was trying to figure this out, and I asked, how much does it actually cost to join this concierge practice? And the answer was $10,000 a year. I'm like, who has that kind of money, $10,000 a year? That's $20,000 a year as a couple to join this practice. If you're there for 10 years, that's $200,000. I couldn't believe. Then they informed me that there's a 1-year waiting list to join. And I'm like, wow, there are a lot of rich people out there. I mean, ironically, no primary care doctor could afford to be in the concierge medicine where some of the primary care doctors work. The access to your physician is immediate and 24/7. They even let you pick your primary care doctor. I pretended to be a patient and they offered me, or I pretended to be an interested prospect in joining the practice. And they said, you can come in for a non-clinical visit and schmooze with your primary care doctor and decide if they have the right personality, the right fit with your personality. I'm like, wow, you get to pick the personality of your primary care doctor. In my practice, or in any other practice, you're so lucky if you can get any primary care doctor, competent, incompetent, good bedside manner, bad bedside manner. And here you get to actually pick out who you see. And their personalities. And then again, as I mentioned, you get 24/7 access to your primary care doctor. When we started my talk, one of the doctors got paged and had to run out because one of their patients got into a car accident by the side of the road, and they called their doctor immediately. I just couldn't believe it. Even before the police arrived, you get to talk to your doctor and say, my neck hurts, my back hurts. I mean, I guess overall that's a good thing, but it's certainly not what our patients get. They wait weeks to months to see us. But I really like these doctors. They didn't create the system, and they, like all the other doctors, are just trying to make sense out of a system that's very broken and becoming, as I mentioned, increasingly corporatized. But I'm still wondering, what do you get for $10,000 that you don't get in our practice, besides nice exam rooms, immediate access to your doctor, and a good coffee in the waiting room, all of which is really nice, don't get me wrong, but $10,000 is just a lot of money. And then I remembered back to my very first practice when I worked with a very well-to-do clientele and a very powerful doctor at a different hospital. And I remember as a young doctor, I would treat everybody the same. And I remember getting reprimanded over the phone, like, so-and-so's a very important patient. They're a VIP. They contribute to the hospital. Why did you let them wait 12 hours in the waiting room before they got admitted? So I've known all along that it's an open secret that well-to-do patients who donate to the hospital get specialty priority access to the specialist. And access to specialists is really the holy grail of good medical care. I had a patient recently who had a spot on their nose, and I referred them to a dermatologist, and it took 13 months for them to get an appointment with a dermatologist. And I couldn't believe it. That's so dangerous. And across the board, as the hospitals become more corporatized and they focus more on the high net worth individuals, the regular patients, it's harder and harder to get into their primary care doctor, and it's harder and harder to get into a specialist. And there's just no way that one of these patients paying $10,000 a year would wait 13 months to see a dermatologist. I can't believe that. Now, I should note that when they advertised all these other perks to the concierge practice, they did not advertise that you get priority access to specialists, but it's an open secret that with this behind the scenes finesse that they do, I'm convinced, I can't prove, and I don't want to cast aspersions, but I'm convinced that they do get enhanced access to specialists. So what does this all mean? It's much more pleasant seeing the doctor, you get better care, but does it actually have an impact on your health outcome? Now, a recent study came out exactly relevant to this, where the rich patients lived 9 years longer than the poor patients. There was a direct correlation between how much you made and how much you had in the bank and how long you lived. And this could have to do with many things. Better nutrition, you could pay for a gym membership, your stress might be lower, you can get a personal trainer, but also I can't help but feel it depends on the quality of the medical care. And certainly if you participate in one of these concierge practices on one side of it versus the poor inner city clinic where I work, just getting the crumbs, getting the bare minimum that the beleaguered doctor can provide in a broken system, obviously you're going to live longer and do better. If you get into specialists earlier, they're going to find the cancer earlier. If you have a lesion on your nose, like my patient, and you get in to see dermatology in 3 to 4 months, it's going to be diagnosed much earlier than if it's diagnosed in 13 months when you finally get a visit as a regular patient. So all of this made me really sad on a number of levels. First of all, it made me remember what it was like when I first started primary care 25 years ago. And in essence, all patients were primary care patients. We had more time to spend with them, more time to listen to them, fewer patients, and we could really get to know them and connect with them. And furthermore, it didn't take 13 months to get anybody into a dermatologist. In effect, all patients were concierge patients, and now there's becoming a growing divide between the rich and the poor. And it gets even worse. My hospital really isn't, none of the hospitals, I shouldn't single out my hospital, they're all doing it. None of the hospitals are supporting primary care doctors. We just get more and more work. We haven't gotten a raise in 5 years, and it's just becoming increasingly impossible to keep up with everything. And how does our hospital address this? They recently said that they're gonna, these are Boston Globe articles, use AI to fill in the gap. Primary care doctors are gonna have an AI system speak to you, and then if there's any problem, they're gonna hook you up with a doctor by telephone or by video conferencing, which doesn't sound as good as just going in, or effective as going in to see your doctor and having them see what you look like, talk to you about how you feel, ask about your kids. It's just much more of a connection and a relationship. And the other thing my hospital is doing to make up for the shortage of primary care is they're starting to implement primary care being given out by nurse practitioners at the CVS Minute Clinics. And I don't really have to go into a long spiel about how that's obviously not as good as seeing your doctor in a primary care practice that's integrated in the hospital, integrated with your specialist. This is again why 88% of the doctors, of the primary care doctors in my hospital system voted to unionize. It's really discouraging when you're working harder than ever and the care you're providing is getting worse. And then you see these other practice models for the rich patients. And again, it's really it's discouraging. And the question is any of this really fair? This doesn't happen in Europe. This doesn't happen. The United States is something like 20th on the list of health outcomes, and we pay more than any other country for our medical care. And thus, obviously, this has been talked about by a lot of people because we spend so much money on nonsense, bureaucracy, and the health insurance companies, which are not looking out for the care of the patients. They're basically looking out for their bottom line. And we have the hospitals now are looking out for their bottom line. Our hospital pays their CEO a 7-digit salary. And like the primary care doctors who work 40 hours a week barely make 6-digit salary. It's really amazing how the hospitals are changing their focus. So what is going to save us from this widening gap between the care received between the rich and the poor? And what's going to save us, it's hard to say because a lot of it has to do with the wealth redistribution in our society, the inequality of the wealth redistribution, where now the top 1% hold the top third of the wealth in our country, and the top 5% hold the top 2/3% of all the wealth in our country. I mean, the rich are getting rich, the poor are getting poorer, and the middle class is slowly evaporating. So it's hard to know who's going to fix this. Again, the insurance companies are making a lot of money. They're not going to fix this. The hospitals love this business model of the top 1% paying $10,000 a year. Multiply that by tens of thousands of patients, and you get really well-paid hospitals and really well-paid hospital executives. Can our government fix this? I mean, our government is heading in the wrong direction. I hate to point fingers, but the current crop of Republicans is just annihilating everything. They're cutting Medicaid, they're cutting healthcare subsidies, fewer people are going to have insurance, they're cutting back on scientific research. I don't think the government is gonna fix this. I don't have a lot of hopeful words. I usually end on a hopeful note. What we're gonna need is some mechanism of like doctors and patients, both groups are suffering, doctors and patients sticking together, banding together, and demanding a healthcare system that works for all of them, equal access to primary care and equal access to specialists and to tests. We don't want to live in a world where the oligarchs have one healthcare system and everybody else has another. We might already be there and it might not be stoppable, but what we need is some kind of socialized medicine or national coherent medical system without the insurance companies playing intermediates so that all people can get access to the primary care that they deserve. This is Dr. Peter Grinspoon. Thank you for listening to my YouTube channel.